and welcome to DE Connect's video spot. Today we're going to chat with Kirrily Chambers. She's the first pharmacist CDE here in Australia and also won CDE of the Year in 2016. Kirrily's got a passion that challenges healthcare professionals to check their choice of words because of the emotional well-being of people with diabetes. This conversation will have you checking your own language choices next time you talk to people with diabetes.
I've had diabetes for a number of years now, more than 30. I was diagnosed when I was 10, and I've used just about every treatment known to people with diabetes. So I'm now currently using continuous glucose monitoring and insulin pump therapy for my diabetes.
And what about your professional life with diabetes as well, Kirrily?
Yes, correct. So I started from a professional point of view as a pharmacist, and then became the first credentialed diabetes educator in Australia. And last year I was very honoured to be nominated and won the CDE of the Year.
Must have been a career highlight, I imagine.
Absolutely, yeah. And I'm very honoured to work with people with diabetes and help them with their journey to understand their disease state and help them understand what's going on.
Tell us about one of your passions around diabetes care.
Particularly language and the impact that it has on people with diabetes and their health. I think that we as health professionals need to be very aware of the language that we use and how that can play on people and also their long-term health.
Can you give us some examples of the kind of things that might upset people?
Yeah, sure. So a lot of people don't understand the language that we use as health care professionals, and it can unfortunately impact on people and their mental health. So people with diabetes have an increased risk of depression and long-term mental health problems. In fact, people with diabetes have about a double risk of depression, and I think some of that is linked to the terms that we use.
Yeah.
For example, test. We ask people to test their blood glucose levels a lot, and that indicates somehow that they may have a pass or failure rate, which is not necessarily the case. You know, at the end of the day, it's just a number. So it's more about monitoring. So that's just about seeing what the blood glucose level is and whether we can act on that maybe in the future to change those numbers. So that's a word that I would prefer not to have used in diabetes.
So what you're saying, Kirrily, is that it's good for us as healthcare professionals to take the time to perhaps do an audit of the language we use around diabetes care, just being conscious of hearing the words and the language that we're using.
Yes, correct. Because again, you know, I see, you know, referrals which will have something like the diabetic, and again, that's a term that's used a lot. We focus on the disease state as opposed to the individual, or it should be the individual first, disease state second. So person with diabetes, because at the end of the day, people start to lose their identity and become the disease, and then it becomes all overwhelming, and it's difficult then for the person to be a person. So at the end of the day, they're just a person. They have a health condition that they have to live with, and sometimes that's, you know, some days is harder than other days. So person with diabetes, and then we get referrals that say things like that the control of the diabetes is poor. And again, they're all terms that could indicate judgment. I'm sure we don't mean it that way as healthcare professionals, but understanding that that for the person with diabetes can indicate some sort of judgment, whereas we can probably use those terms with much better effect, I think.
I certainly try to be careful with the words that I use. However, there are times when people, for example, hear I'm a diabetes educator and they'll say I'm a diabetic. So how do you think that we should manage that when it happens?
I think if the person doesn't have any mental health issues in the short or the long term, and they're comfortable to use that terminology, then that's probably okay. I don't think that we should reflect that again, because just because it's widely used doesn't mean that it should be widely used, so to speak. So I think that if they're comfortable to use the terminology, then that's okay. And I don't think that people should be judged again because they refer to themselves as being diabetic.
Yeah.
But I think it's because it's widely accepted. And just because, again, it's widely accepted doesn't mean that it should be widely accepted.
So it's really getting people to consciously think about the words that they use and making them less judgmental when they're talking to someone with diabetes.
I think so, yes, because again, if people are at one and understand and don't have any resentment towards their health condition, then that's absolutely fine. It doesn't mean that they may not develop that along their journey at some stage, and again, there shouldn't be any judgment with that, because it can be awing and very overwhelming sometimes for someone to live with a health condition that can be chronic. So people, have waves where they will accept the health condition and then want to reject it at certain points. It's like any condition that you have to live with, that diabetes can, take its toll sometimes. So, accepting that the language does need to change. Again, if someone has dementia, we try, and we haven't for quite some time, called them demented, because again, person first, disease state second.
I think you make a great point. Are there some resources that you would like to recommend for people to use to review the language that they use to make sure that they're not causing people offence?
Yeah, there's a really good one. Diabetes Australia released a position statement called Language That We Use with Diabetes, and that was released in 2010. So that's available on the Diabetes Australia website.
Thank you, Kirrily. You've provided us with some very relevant and insightful practice points to consider in our care of people with diabetes.
You're welcome.
Bye.
Bye.